Hello, this is Dr. Farhangfar. I hope that you're doing well and you're getting some benefit from the shift elevation videos that I've been making for you. I welcome any questions or comments that you may have regarding anything that I've been discussing for you so far. Today, I want to talk about an important area of obesity medicine that has gained significant interest recently with the introduction of the new class of medication, the GLP-1 injectables are becoming very popular. Medication like Ozempic and Zepbound, Wegovy, Mounjaro. These are referred to as miracle drugs for treatment of obesity. Before we get started, let's go ahead and discuss the warning information that are presented today are for educational purposes. Please consult your own medical professional for your particular situation before starting any kind of treatment program. So today we're going to talk about new anti-obesity medication. I want to discuss the impact of this medication for treatment of obesity, including effectiveness, side effects, cost of this medication. As you know, obesity is a chronic medical condition, and it requires a comprehensive approach, not a short-term view of the problem, but a long-term effective program. Effective management oftentimes requires a comprehensive approach, including low-calorie diet, increased physical activity, behavioral modification, and careful selection of medication for best results. There's been historical concern about the safety and efficacy of the anti-obesity medication, many of which were withdrawn from the market due to the side effects. Anti-obesity medication should never be used as a first line of treatment without proper evaluation of the underlying medical causes of obesity. Unfortunately, without proper lifestyle changes, whatever weight loss is achieved with these medication will come back after patients stop taking this medication. So every person is unique. Everyone has a different biology, lifestyle, comorbidities, and successful weight loss program should be individualized based on patient preferences, lifestyle, and other consideration. So let's talk about the new incretin type medication that are available for weight loss. These medications mimic the endogenous gut hormones and deliver significant weight loss never seen before with the older medication. These are similar to the gut hormones that are secreted naturally, and they have widespread effect on the body. They function by stimulating the release of insulin from the pancreas. They suppress the glucagon, a hormone that raises blood sugar. They reduce gastric emptying and helping you feel full. They reduce food intake by signaling satiety and fullness to the brain. They improve glucose storage in the muscle tissue. They lower stomach acid and help regulate digestion. GLP-1 receptors are found throughout the body. In the gastrointestinal tract, they slow down gastric emptying, causing a feeling of fullness. And also the side effects that we oftentimes see with this medication, nausea, vomiting. And one of these medications is called Semaglutide or Ozempic, demonstrates substantial weight loss and cardiovascular benefits. These medications are FDA approved for treatment of diabetes as well as reducing cardiovascular disease, including heart attack and stroke in patients with established cardiovascular disease and obesity. Tirzepatide or Zepbound is another type of GLP-1 GIP dual agonist, receptor agonist, which delivers exceptional weight loss demonstrated in the Surmount trial. Showing between 16 to 12.5% reduction, outperforming semaglutide in head-to-head trials. Average weight loss with tirzepatide was approximately 46.08 pounds after 72 weeks, representing 20.2% compared to 13.7% weight loss compared to Ozempic. Unfortunately, these are dangerous drugs that have box warning. They may create side effects. Common side effects include nausea, vomiting, and abdominal pain, which usually are more intense when medication are initiated. As time goes on, people become accustomed to these side effects by changing the diet, and the side effects will often diminish. The box warning regarding the potential increased risk of thyroid cell cancers. These medications are contraindicated in patients that have a family or personal history of medullary thyroid carcinoma or multiple endocrine neoplasia. And the severe side effects include pancreatitis, gallbladder disease, such as gallstone formation, acute kidney disease, suicidal behavior and ideation, requiring close patient monitoring and education. Tirzepatide also reduces the efficacy of birth control pills, and patients, especially when they get started, they are required to use other forms of contraception. So you can see the comparative treatment efficacy of different modes of treatment. Lifestyle alone, compared to older medications, single medication like phentermine, orlistat, versus combination medication versus the newer type of incretin medication. Practical consideration include treatment that includes exercise and proper diet, and being mindful of the safety and the efficacy of the newer medication. Financial consideration, insurance coverage should also be taken into account, realizing the long-term benefit depends on continual use. And oftentimes when patients stop using this medication, the weight comes back. Unfortunately, access to these newer medications are much more restricted due to the cost. However, these medications are becoming more widely available as insurance companies are starting to pay for these medications. So they do require initial evaluation, ongoing monitoring, lifestyle integration, and long-term monitoring and adjustment based on individual cases. To summarize, obesity is a chronic medical condition that should be treated as such, with long-term view of the problem and avoidance of shortcuts, temporary fixes, diet and physical activity, along with behavioral changes remains the mainstay of the treatment for obesity, and they provide the best result. Lasting success requires the tailored treatment approach that balances safety and efficacy and the cost of newer drugs, and commitment to continuous therapy for sustained benefits. If you're interested in learning more about newer GLP type medications for treatment of obesity, I invite you to sign up below for a free weight loss consultation to determine if medication is suitable for your weight loss journey. I thank you for your attention. I look forward to seeing you next week. Continue focusing on your weight loss goals.